Good day, guys. I am here to present about the topic of natural language processing. So I will be having a review about the article with the title of Case Report Utilizing AI and NLP to assist with the healthcare and rehabilitation during the COVID-19 pandemic. So I will move on to my next slide. So this will be my presentation overview. So I will go ahead to my first slide, which is the authors. So the authors came from Canada, and they are Jay Carrier, Harim Shafi, Caitlin Brehon, Kiran Puhar Manhas, Katie Churchill, Chester Ho, Maddy Tabacoli. So I will go ahead to the objective. So this article, the objective is to present a perspective on how artificial intelligence and machine learning technologies such as NLP or the natural language processing can be possibly used to assist with the assessment and rehabilitation of acute and chronic conditions, especially with this pandemic. So the question of the research that I was identified is how artificial intelligence, machine learning, and natural language processing can be applied in healthcare sector during the COVID-19 pandemic. So I will move on to the methods of the research. So in this research article, the authors cite some review of related studies about the use of artificial intelligence, machine learning, and an application of natural language processing in analyzing the data sets that came from the health sector. So they discuss one by one how those technologies can be adopted in healthcare system, especially in this time of pandemic. So they are basing their studies about the review of related literature that they cited to formulate a conclusion. So let's go ahead. So they also propose a case study about the rehabilitation advice line or the RAL. So this RAL was first introduced in Canada, and this is a telephone service that allows patient caregivers to speak directly with the rehabilitation clinicians and professionals, and how this RAL can adopt the use of AIML systems and application of natural language processing in analyzing clinical notes during the call. So the RAL that was first introduced in Canada was a manual question and answer between the patients and the professional or the caregivers or other doctors that is expert on their respective environment. So in this research article, so they propose to use AI or artificial intelligence machine learning with the use of natural language processing in communicating uh, clinical notes during the time of call. Yes. So let's move on. Then this would be in this picture or in this illustration, you will see the proposed NLP ML processing pipeline. So as you can see, the rehab line call record. So and rehab advice line call record. So they have the history, action, and disposition. So that is all the information that came from the patient. And during the call, as they said in the proposed article, so they will be using NLP or the natural language processing to analyze the dataset that came from the rehab line call records. So After analyzing all the data sets and information from the rehab advice line call record, so the NLP will provide the information to the AI or the artificial intelligence slash machine learning analysis to analyze all the data and to give a right conclusion or the appropriate conclusion by using all the the pattern or the demographics, the color categorization, the patent care plan, and the rehabilitation modeling and predictions. So this will be the flow chart of the proposed NLP or the AI machine learning technology that will be applied in the rehab advice line or the RAD. So the findings. Author discussed the perspective of the paper, the use of AI/ML technologies to assist the assessment, diagnosis, and treatment of acute and chronic musculoskeletal, neurological, and other conditions during the COVID-19 pandemic. They also provided examples of AI/ML technologies applied to areas such as medical analysis, robotic rehabilitation, and assessment, and NLP systems that allows in demoting hands-off treatment and assessment of persons with acute and chronic conditions. So for other findings or the CUP studies, they also identified factors that is need to be addressed during adaptation of AI ML system. So we have here the accuracy and safety. So these factors are need to be addressed or considered because of some electronic health records have absence in available or annotated data sets, which can be used to develop and validate NLP systems. So with that absence, uh, accuracy and safety should be considered. Then ethics and privacy and security. So because of innovations of new technologies, so this factor should be addressed in developing AI ML technologies in healthcare sector. So this needs to be considered because of the progressing technology or the innovation that we are encountering. So that would be it. Thank you for listening, and I hope you learn from my discussion. Thank you.